People always ask me about what's the latest and greatest in plastic surgery. And for years, we were always talking about advances in the OR, new technologies that helped with surgery. And what's really neat, what's really interesting, is that the surgery piece to this process is just one part of it. And today, advances in technology, things that aren't necessarily directed at patient-doctor discussions, are making huge advances to make the entire process of surgery that much better. Specifically, the consultation. When a patient comes in for a consultation, they need to know a few things. They need to know today what they're going to look like. They need to know what it's going to take to get them there. And they need to know whether it's safe and appropriate for them to do so. We used to show pictures. We used to be able to draw on pictures to try and give them some demonstration of what they're going to look like. We can show you, we can morph you both in 2 dimensions and 3 dimensions as to what you're going to look like. And therefore the leap of faith to have surgery on your face, on your nose, on your breast is so much less. But to really make things better, we now have the technology, and some of this comes through social media, to take your consultation and bring it home. In our practice, we've used it in 2 areas. One, before you ever walk in the door, we have a private website where you can learn about what you're coming to see us for. You can see specific before and afters about the procedure you're going to have. And you can help get comfortable with the practice before you ever walk in the door. Therefore, I think the anxiety is reduced, you can listen better when you're there, and you can get comfortable whether this is the right decision for you or not. The second thing is we have technology now that can take your consultation and allow you to review it and bring it at home. You can show your significant other, you can look at it yourself, you can come up with questions you may not have asked. So if you know what you're going to see before you get there, you communicate well with your doctor about what your expectations are because you're prepared, and then you and your physician are on the same page, then all the physician has to do is conduct an operation that meets those needs. And many of the question marks are gone away. That can only lead to great outcomes and better results.